for joining us for another impactful session of the Serenity Resource Connect Community Corner Live Forum. This evening, we're diving into the incredible health benefits provided by the National Health Fund. I'm your host, Winsome Sherrier Witter, and it's my honor to welcome Shermaine Robotham, Director of Health Relations at NHF, who will guide us through everything we need to know, from the illnesses covered to finding participating providers and unlocking the full potential of those transformative services. So we're also thrilled to have on board with us supporting our engagement partner, Young's, the People's Pharmacy in Maype and Clarendon, whose collaboration makes tonight's forum possible as we continue empowering communities across Jamaica and beyond. So sit back, relax, and let's explore how the NHF can enhance your health journey. And don't forget, we'll be answering your questions live later, so stay tuned to the end. And let me make room for Shermaine Robotham. And for those of you who are as young as I am, you might remember the name, right, Lady Robotham?
Yes, they might remember the name.
All right. Thank you so much for joining us here on the Community Corner, where we get to share with you, or you get to share rather with our viewers, so we can have a better understanding as to how the NHF works. And as usual, we keep it engaging, so you can share in the comments as we discuss, and you can make note of your question and we'll take them later on. So we have a lot to cover as the NHF is covering us in so many areas. So let's start with a brief overview of the National Health Fund and its role in supporting health and wellness across Jamaica.
Thank you for having me, Winsome, and I look forward this evening. So the National Health Fund, NHF for short, it's a statutory body, and it was established to reduce the financial burden on the Jamaican population. Were established in 2003. So there are four areas basically where the NHF provides this financial support to the Jamaican population. First of all, there is the NHF card, and a lot of persons know about the NHF card. It provides subsidies for specific medication, medical supplies, and health screening. So you can use your NHF card and get some discount of these services. Then, of course, the NHF also manages the public sector pharmacies on behalf of the Ministry of Health. So we deliver both inpatient, that is in hospital, and outpatient pharmacy services for the public sector. And this includes the management of the medical warehouse. The fund, the NHF, also provides funding to institutions, mainly in the public sector, to improve healthcare delivery. And so we give grants to improve health infrastructure, whether to upgrade a facility or to build new ones. We also provide funding to buy medical equipment and to buy ambulances and other means of transportation, as well as provide grants for disaster preparedness. And fourthly, the NHF also funds and supports health promotion. So those are the main areas that the NHF provides this financial support. We have over 800 staff members working across the island in all our drug serve locations, at the warehouse, and at our head office in Kingston. And just to say, when you hear about the National Health Fund, generally you hear about excellence in customer service. And we have quite a number of awards that we have won over the years for the kind of quality service that we provide to our customers. So all in all, it's an agency that provides great support in health. And not only that, but we do take care of our customers and to treat them, as persons of value. because we're all Jamaicans and we want to ensure that when you walk through our doors, you get great service.
Yes, and I can attest to the quality of service because I've experienced, I think, twice at the Mayben Hospital, the drugs served there, and I must say I am impressed with the the process, and even with the security guard that's there in terms of the information he or she's able to provide to assist patients as they wait to be served. So kudos to NHF and DrugServe on that. All right, so we have some persons joining us over on Instagram. Thank you so much for tuning in, and we are not able to bring your comments on screen from Instagram, just from Facebook and YouTube, but I'll be checking in periodically to see what's going on over there. All right, so let's talk about benefits. You mentioned so many different areas, and I'm learning a lot more because I didn't realize that it was the NHF that supports in terms of ambulance and all those good stuff. So a lot going on there, but in terms of benefits, what specific illnesses and conditions are covered under the NHF card? And are there any recent additions to this list?
Right. So the overall list is 22 conditions, right? So I'll name them.
Yes.
Asthma, arthritis, breast cancer, benign prostatic hyperplasia, and that's short for enlarged prostate. And as men get older, they have enlarged prostate and they have, problems with urine and so on. So that's benign prostatic hyperplasia. There's diabetes, epilepsy, glaucoma, high cholesterol, high blood pressure, heart disease, lupus, major depression, prostate cancer, psychosis, rheumatic fever, heart disease, sickle cell disease, and vascular disease. And late last year, we added 5 conditions: colorectal cancer, lung cancer, multiple myeloma, Parkinson's disease, and thyroid disease. So overall, that's 22 conditions that's covered on the NHF card. But just to say, Winsome, that the NHF card not only provides coverage for medication, as I mentioned earlier, we also provide subsidies for the HbA1c test. This is a test that diabetics need to do at least 4 per year, and we provide a subsidy for that. We also provide a subsidy for the breast cancer receptor studies test. When you're diagnosed with breast cancer, there's a test that needs to be done to see, what type of cancer they're dealing with. And so there's a subsidy that we offer for that. And earlier this year, we added pap smear to the NHF card. So we have a subsidy of $1,300 for pap smear that is available for women 21 years to 64 years old using the NHF card. And they're able to get 1 test every 3 years. And that's because that's the national screening guidelines coming out of the ministry, that you should get your pap smear once every 3 years. However, there are women who are high risk, and they are allowed to get a pap smear every year. The other screening test that we offer, which is major, is of course a subsidy for the PSA test. That's the test for prostate cancer. And there's a subsidy of $1,600. And as long as you are a man living in Jamaica, 40-year-old to 74-year-old, you can use the NHF card or get the NHF card to access this subsidy from laboratories. So those are the benefits available on the NHF card. And one more, if you are diabetic, you have to test your sugar on a regular basis at home. We provide free glucometers through the NHF program for diabetics. You can give us, our customer care, a call, tell us which glucometer you want. The list is also available on our website. And you get the subsidy for the strips also for the needle to prick your finger to get the drop of blood if you're using that method. And you also have subsidies for masks for asthmatics, because children, it may be difficult for them to pump and hold and all of that. So there's a mask that is used to put the medication in, and then they breathe to inhale it. So we have a subsidy for that as well. So those are the subsidies or the benefits available on the NHF card.
Okay. What about those persons that's hypertensive? Because we have quite a bit of that. I understand that Clarendon has a large number of persons who have been diagnosed, especially with the ongoing series of health checks being done. A number of persons are showing up as hypertensive. Anything for those people?
Well, hypertension is the condition with the most persons on the NHF card program,
Okay.
which shows that it is very, we do have a lot of persons with hypertension. And what we do provide for the hypertensives is subsidies for the medication. We do not yet provide the blood pressure machine. Persons have been asking about that, but when we're going to add something to the program, we have to ensure that we have the money to support it. So at the moment, what we provide for the persons with hypertension is medication. And recently we increased the subsidies for hypertension on the NHF card to bring it closer to 50% of the cost of the drug.
I'm sure that makes a big difference considering the cost of medication. So it's support, because we're not able to do full coverage, right?
Right. So the NHF card provides a subsidy for the drug. I mean, we could not provide full subsidy for the number of persons. We have some over 350,000 persons are actively using their NHF card. It would be, the budget would just blow. So we do provide something off, and we aim to keep it at about 50% of the cost of the drug. Of course, when you look at the subsidy list on the NHF website, or if you visit our offices and you're given a brochure with a subsidy that's provided, you'll see a specific amount for each tablet or injection, right? Because it's not like your other health cards that give you a percentage of what the pharmacy is charging. Our subsidy is fixed. So whether you're buying your medication in Westmoreland, in Clarendon, or in Kingston, it's the same subsidy that NHF pays. And we do, a check on the market to see what's the price, and then we try to keep it at 50% on average of the cost of the medication.
All right. Before we move on to the next segment, you mentioned earlier for men, and I suppose others living in Jamaica. What about our Jamaicans in the diaspora who come home and they want to take advantage of the services?
No, you must be living here. Winsome, the pocket is not endless. Okay? So we're taking care of the population that lives here.
Okay. Just want to make sure, because we do have viewers from the diaspora, so we want to make sure that they are aware as to how the program actually works. Yes. So when they come home, it's not like the TRN card where you can go get your TRN card. The NHF card is for those living in Jamaica. All
yes.
right.
You must be a resident of Jamaica.
All right. Yes. Resident for how long? For those returning residents?
If you're a returning resident and you are a resident here, that means you live here for, there's a stipulation over 6 months for the year.
6 months.
You're a resident, yes.
All right. All right. Just getting that out there. All right,
Yeah.
so let's go to the process now. So we hear all of these nice things, and some people might be saying, I didn't know that I could get subsidy. That would help a whole lot. How can they apply for NHF card? And are
Mhm.
there documentations that's
That they
needed to
need.
do that, right?
Yes, you have to apply. You need a application form, and I have an application form here, right? You can collect this form from any of our NHF locations. Doctors' offices carry these forms as well as pharmacies. You can get it from any of these locations. You can also visit our website and you can download this application form and complete it. Now, when you're completing the form, this is a form for an individual. So sometimes persons ask, if I have the NHF card, can my family use it? And the answer would be no. Each member of the family would need to have their own card. So each individual would fill out the form. Section A is for the beneficiary. So if the beneficiary is a child, because we do cover, the NHF card covers children, then it's section A that's completed for the individual that's going to get the card. If it's a child, then there's a section B that the guardian or the parent would have to fill that out. That is if you're below 18. And then, having completed it with your name, address, your TRN, you must have a TRN. You take that to your doctor, and your doctor will fill out the section for the condition for which he or she has diagnosed you. Only doctors can diagnose a condition, right? So they must complete section C and they have to sign it. They have to put in their Medical Council of Jamaica number, etc. Now, having completed that form, you then take the completed form to one of our NHF card centers. And we have 20 centers across the island. At our major drugstore pharmacy, or in Maypen, for example, at the Maypen Hospital, you'll find the NHF card center, and you take the application, complete the application there. And once everything is fine, you will get your NHF card within 15 minutes. Now, I must say also, there's another way that you can get your NHF card. There are some doctors who have signed up for online registration of their patients. So if you visit the doctor and he or she has signed up to enroll their patients online, once they have diagnosed you, they can fill out something online. That comes directly to the NHF. And what we do is we call the patient, let them know that we have an application for them, and find out which location they'd like to pick up their card, and voila, they come to us and they have their NHF card. So that's the process of enrollment. And once you have, of course, your card in hand, we have over 480 private providers across Jamaica that you can go to use your NHF card to get the subsidy on your medication that's on the NHF list. I'm not hearing you, Winsome. You're muted.
Oh, thank you so much. Talking to myself. Or what happens if someone loses their NHF card or they're having trouble accessing the services?
If you lose your NHF card, it's very easy. You come to one of the card centers and you advise us that you have lost your NHF card. We'll ask you to fill out the top of a form and indicate lost card, and we will replace your card. If you have lost your card, you do not need to go back to your doctor to have your doctor sign it up all over again. We would have had all of that information. So once you have, completed the form and signed that you have lost the card, we just replace your card. So it's very, very easy to get a new card. If you're having issues with your NHF card, and there are various reasons why you may have an issue with your card, you need to call our customer care center, state what the challenges that you're having, and we will work it out for you. Once you have enrolled for the NHF card, for example, say you got hypertension a couple of years ago and subsequently you have developed high cholesterol. When you take your prescription to the pharmacy to be filled out, you will only get medication for hypertension. You will not get the medication for, you'll get the medication, but you won't get the NHF subsidy, right? So that is one of the ways in which that you may have a challenge with your card. Now, if that happens, you will need to go back to your doctor, because the doctor would have to diagnose that you have this condition and would have to indicate on the application form. And then we would add that new condition to your card. You wouldn't get a new card. So as you, get a new condition, and we hope that you're practicing a healthy lifestyle so you don't get too many, that's added to your card, and you won't have a challenge going forward. But if you're having any challenges at all, please call our customer care center, 906-1106, and they'll be happy to sort it out for you. You could also talk to us on web chat on our website as well.
All right. So many different options to connect.
Yes.
And get support. That is really awesome. All right. So you mentioned in terms of the most, if all the public hospitals, the major hospitals across the parish, the island rather. But what about the role? Explain the role of pharmacies and healthcare, like our private healthcare providers, in delivering NHF services. And how can we easily identify which of these entities offer or utilize the NHF cards?
Right. So to identify which pharmacy is using the NHF card, they usually have a decal on the door that says NHF card accepted here. Okay. You could also go on our website, in which we have a detailed list of all the nearly 500 pharmacies that accept the NHF card across the island. And of course, what they do is that when you go there, you hand the pharmacy your prescription and your NHF card, and they deduct the subsidy that the NHF offers for you. So what you do is pay the difference. And then we then give back the pharmacy the subsidy that you received for your card. So that's the role of the pharmacies. They, just provide the benefits on the NHF card for you.
All right. So for those viewers who might be seeing this and they visit their pharmacy or their private practitioner, and they do not accept the card, how can those pharmacies, medical providers, how can they come on board to offer the service?
Yes. So to come on board, they would need, of course, to apply to us to be a provider, whether a pharmacy provider or a provider of laboratory services, or doctors who can provide the pap smear benefit. On our website, you visit the provider relations page, and you will see there's a drop-down menu there. You can click on the one to become a provider, and you'll see the application form. So once you've completed that application form, you would need to supply with us various documents, and the documents would be listed there. If you're a pharmacy, for example, you would need to have a registering pharmacist. We would need to see all the relevant documents from the Pharmacy Council of Jamaica, police record, your ID, etc., and other pieces of information that when you connect with our provider relations department, they will provide you with all of that information. But on our website, it's also there. For the doctors, and this is a special appeal for all the doctors who may be watching this show, And for all those who are watching, we ask you to tell your doctors that the NHF now provides the pap smear and encourage them to become NHF providers. So that when you go, women, when you go to the doctor and you're doing your pap smear, you can swipe your NHF card and get the NHF benefit. So it's a easy process. And also we try to onboard, when you apply as a provider, we have a 10-day turnaround time to approve the process. So once all your papers are in, it's a 10-day turnaround time. Once we have approved your status as a provider, we send you a contract. Once the contract is signed, we get you on the program within a day or two of signature. So we try very hard to also provide excellent service for those who want to be NHF providers. And the same is true for our laboratories across the island as well.
Okay, so are there any plans for new services or any other area? You mentioned pap smear in terms of expansion to underserved areas. Are we covered in all other areas?
Well, in terms of partnerships for services across Jamaica, I would say we are well covered with the NHF card. There's hardly any pharmacy in Jamaica that does not accept the NHF card. So that's 480 private pharmacies across the island. As I said, our challenge right now is the number of doctors who accept the NHF card for the new benefit, pap smear. It's a new benefit, so we don't have as many providers as yet. So we are now working very hard to get the doctors on board to sign up to become providers. We have been visiting doctors' offices. We have been addressing medical conferences. We have sent emails through the Medical Association of Jamaica. We have had digital ads. So it's something that we're pushing to really get the doctors to sign up to become providers. When it comes to the addition of new benefits, as I said earlier, we are looking at what are the benefits that we can add to the program to add value. But at the same time, we have to bear in mind what is our funding and what it is that we can afford. So for example, this year, you see where we added pap smear, and this now soon we will be adding another condition, and next year, we're adding another screening, but all of this takes time. So, but we're always seeking to improve services to our Jamaican residents. Now, just to say that since you mentioned underserved areas, we talked earlier about DrugServe and the fact that the NHF manages the public sector service. We have 106 DrugServe locations. 50 of them are full-time locations. So, for example, Maypen Hospital would be full-time. Maypen Health Center would be full-time. So the major hospitals, you have full-time service and major health centers, but there are some health centers where we go, 56 of them, where we have scheduled service. So we're not there every day, but the service is scheduled. So when the doctors are there, the pharmacy services would be provided. So we have a good coverage across the island for medication.
Fantastic. All right. So does the NHF offer any additional programs like health fairs? A lot of health fairs taking place, or public screenings to support community health. We have a lot of health fairs popping up in different areas, but I don't remember seeing NHF.
What? We are out there in the community.
Okay.
We have churches, clubs, service clubs writing to us on a weekly, I would say almost daily basis to assist them in providing screening at their health fairs. just to say that if you're going to write to us to ask for this sponsorship for screening, we need 6 weeks notice. 6 weeks ahead of at least 6 weeks ahead of your event, you need to write to us, because we do have quite a number of persons writing, and we don't want persons to wait until the last minute. You're unlikely to get help if you're waiting until the last minute, right? Last financial year, we did 79,000 free screening tests to the public because we want to promote preventive care. Among the tests we offered were blood sugar tests, blood pressure checks, hemoglobin, cholesterol, ECG, BMI, as well as pap smear, mammogram, and PSA. The Cancer Society helps with those. We also do a series of back to school health fairs where we do provide the essential health services to students and other community members. So we are quite active in the community, assisting with the provision of screening tests, but also with the provision of information about the NHF and healthy living as well. So do write to us if you need help, and we'll see what we can do.
All right. Or is shared in terms of when you're out there in the communities, you share information for changes as it relates to their benefits and updates to the program for those who are already on. How do they usually get this information?
Right. So social media is definitely one of the ways that we use to get the information out once we have any updates, any changes, addition of new drugs or addition of new benefits. It's on our social media pages, so you can go back, of course, and you can look to see all of the changes. We also put out an ad in the print media on a monthly basis to see what are the conditions, what are the medications that have been added. You can always call our customer care department to find out, if you are unsure about a medication that is on the program, you can always call us via telephone or web chat with us. Yeah, and of course, on our website, you will always find the information there in relation to the changes. We have a health show on one of our radio stations, RJR, Healthy Interest, on Tuesday mornings, 9:45. We also provide information there. And of course, forums like this.
Okay, thank you. All right, and the website is NHF Jamaica.
No, nhf.org.jm.
Okay, nhf.org.jm. All right.
Yes.
Right. You do have a comprehensive list there that you're able to see in terms of the parishes. I was able to see the pharmacies that are on the program. I did see something though, NHF card, and is it JADEP you pronounce it?
JADEP, right.
Yes.
Glad you brought that up. I should have spoken about that earlier when we were talking about the NHF card.
Okay.
So on the NHF card is for persons of all ages, right? If you're 18 and below, right, your child, you get double subsidy. So whatever the subsidy is on the program, children get double. However, we don't give 100%. So if the double would take you to 100% or over, we don't give you 100%. We give you 95% of the cost of the drug, right?
Okay.
When you get to 19, then you start paying, it's not double subsidy anymore. But when you get to 60, we have a basket of drugs, about 75 of them, that you can get on the Jamaica Drug for the Elderly program. And for this, you can get a month supply of a drug for $40. If you have up to 6 or more, it is 6 times 40. How much is that? $280.
$240.
$40.
We're talking about Jamaican dollars?
Yes, Jamaican dollars for 6 or more. but this is for items that are on the JADEP list, right? It must be
Okay.
on the JADEP list. And we have quite a number of pharmacies that provide the JADEP service. Not every NHF pharmacy provides a JADEP service, but we have nearly 200 and over 250 that do. So these pharmacies, you can get your JADEP benefit using the NHF card. Just to say that we used to have two cards. We used to have JADEP card that you get that you get at 60, and the NHF card. But we merged them. So what it means that if you have both cards, you can put the JADEP card aside, right?
Okay.
And only use the NHF card. Now, there are still a few persons who have only the JADEP card, right? Last time we checked, there are about 500 persons who are still using only the JADEP card. And we are encouraged, if you're one of these persons and you're listening, or you know of someone who only has a JADEP card, we're encouraging them to get the NHF card, because the NHF card has more benefits, as I stated earlier. So, for example, if you're a diabetic, you can use the NHF card to help you buy the test strips, right? If your medication is not on the JADEP list, it's on the NHF list, you get a discount to buy those medications. So it's important that if you only have a JADEP, that you try as soon as possible and upgrade to the NHF. You mentioned earlier persons who are abroad, and many persons take care of their, older relatives here in Jamaica. And certainly one of the things that they can do is to encourage their older relatives, or their relatives, if they have any of the conditions on the NHF card, to sign up for the program, because they would be paying less for the cost of their medication.
Okay. All right. Just to clarify, so for those with the JADEP card, because you said there's a list on the JADEP that might not be on the NHF card, is that
Yes.
so? Right.
Yes.
So if it is that they only have the NHF card, they would not be able to use the NHF card to get the drugs on the JADEP list. Is that so?
No, no, no. What I'm
The
saying,
NHS card gives you
card,
access to all?
yes.
Ah, so they
The,
only need the NHF card. And
yes.
how would the pharmacist know that they're 60? Because there are a number of 60-year-old who don't look anywhere near 60.
Well, the card
Card
has
has all the details. Ah,
yes,
okay.
back end.
Oh,
So if you say, you want it under JADEP and you're 59, then they'll say, sorry, you can't get it. You're not yet 60.
okay.
Yes. But what I'm saying is that we used to have two separate cards, the NHF
Yes.
card and the JADEP. It has been merged.
Okay.
So once you get to 60, we no longer issue a JADEP card, because you can use the same NHF card to get the JADEP drugs. The only thing is that you get the JADEP drugs at a NHF pharmacy that is participating in the JADEP program. Not
Oh,
every pharmacy participates in the JADEP program. That's a business decision, because, remember, it's a program that's helping the elderly.
oh, right. It's great that you mentioned that, because if I have an NHF card and I see the sign, I'm expecting that I'm going to get all the drugs that I need there. So would we say that they're underserved when it comes on to JADEP, seeing that we're talking about elderly?
I wouldn't say they are underserved, no, because they have the access for over 250 pharmacies, right? And many of our elderly, they do get service at our drug serve locations. And at our drug serve locations, they're getting the medication free of cost.
Okay. All right. Just want to make sure that our
Yes,
elderly
but,
are
but
taken
I would
covered.
go on to say though
Yes.
that the NHF is consistently seeking to improve our services, right? So JADEP is one of the areas that we are, looking at to see what improvements can be made to the program. In the same way that we continue to look at the NHF card program and see what additional benefits we can add. So it's a process. We are continually looking to see what improvements can be made, because we can't say that we're perfect, right? And everybody's being served. It's an ongoing process of improvement to ensure that we reach as many persons as possible.
Awesome. The important thing is that you continually improve. All right, Sir Pusey, I see your question. We'll be taking questions in a little while. For others who are on, if you have questions, now is your time to ask Lady Robotham, because you might not get direct access to her like this anytime soon. So let's ask our question so we can get the clarity that we need. All right. What practical advice would you give to someone who feels overwhelmed navigating the health benefits or accessing care through the NHF? Because as simple as it sounds, there might be some persons who will struggle. So help them to navigate.
Right. So the first area of your journey is going to be signing up for the card, right? That's the first part of your journey. And it's very easy, as you see here. You fill out the top. If it's for a child, the parent has to sign it, and then your doctor would tick the condition down here, sign his, put in his name, his MCJ number. Once you have done that, you take it to any of our NHF card centers, and it takes you 15 minutes to get your NHF card in your hand. You take the NHF card with your prescription to the pharmacy, and you get the discount on the medications that you are signed up for. Very easy. If you're having any challenges at all, give us a call. We pride ourselves in listening to our customers and taking good care of them. We have won awards for what we do, and we want to ensure that when you call us, we're going to solve your problem. And give us a call, 906-1106. Speak to our customer care officers. And just to let you know that our customer care center is open from 7 a.m. to 7 p.m. So you can call during that time, or you can web chat with us and talk to us about your needs. If you're on social media, you can also send us a message or a direct message, and we will also get to you to help solve your problems. So it's easy to access. Accessing the NHF card, we have 480 pharmacies across Jamaica. In any major town center, you're going to find a pharmacy, more than one, that accepts the NHF card. So those are the ways in which you can get in touch with us. Don't feel overwhelmed. We're here to help you to ensure that you have easy access to your benefits. And so that's the NHF card. We also manage DrugServe. One of the good things we have been doing at DrugServe since the NHF took over management of DrugServe is that we're reducing the waiting time. So you don't wait too long. And there are different services that we have for DrugServe. So whether you're going to use our Quick Prescript app, where you send in your application and say where you want to pick it up, you don't have to go into the pharmacy and wait long, right? You can drop off and pick up later in the evening. Now we have a service where we are giving persons who have chronic diseases, we take medication every month. We're not just giving them 1 month supply, we're giving 2 months or 3 months supply, so that you don't have to be coming back to the pharmacy every minute. So that's helping with not being overwhelmed, right? I have to travel
Right.
to the pharmacy again. So we're here to help you. Give us a call and we will work through whatever problems you are having.
Fantastic. All right, let's take Mr. Pugh's first question. Does the NHF offer lead testing to the Jamaican population? Because lead may cause developmental delays in our kids and even memory issues in adults.
Currently, we do not. As I had said before, we are looking at the impact that a particular test would have on the population. It would have to have major we would be focusing more on those conditions or tests that would have impact on a large population. So that's the initial focus. But if you're interested and would like NHF to consider lead testing, then persons could always lobby. And lobbying means writing letters and asking for it, and see whether in time we can get to lead testing. But currently we do not offer that.
Okay. All right. So please again, if I am 30 years old and unemployed, can I still sign up for this card, or are there underlying criteria that needs to be met in order to sign up?
Yes. So the criteria, you must live in Jamaica. One, whether you're employed, unemployed, live in country, town, young, old, as long as you live in Jamaica. Tick. Next thing, you must have one of the conditions. If you're applying for the conditions, you must have one of the conditions that the NHF covers, and you'll be covered. If you're 30 years old, this is a female, then she can sign up for the NHF card to get help with the pap smear. So yeah, the card is available as long as you live in Jamaica and have any of the conditions covered by the NHF, the 22 conditions. Or if you're a woman 21 years and over, you can sign up for the pap smear. You don't have to have one of the conditions. Or if you're a male 40 to 74, you can get an NHF card to help you with the PSA test.
Right. Could you recommend a location in Ocho Rios to sign up for the NHF card?
So we don't have a location in Ocho Rios, but there's a location at the St. Anne's Bay Hospital. That's the NHF card center there.
All right. Right. For the previous question, he says, noted, thanks a lot for that information. And we have some virtual flowers coming over here. Commendations to the sterling work of the NHF. Lady Ava, thanks as always for tuning in and sharing the information. All right, so we have a little more time. So if you have questions, now is the time to ask so that you can be clear when you leave here and you can share the information with the others in your community so that we can help to provide additional support. So please say thank you again, prior hand. All right. All right, glad we could help with clarifying some of that, those areas. All right, so if there are, okay, let's see. Blossom Jones, thank you for tuning in, Lady Jones. Pharmacists do not seem to be aware that more than 1 month's supply may be dispensed. How does this policy reconcile with private medical providers? Will they also provide more than 1 month's supply? That's for the private.
Right. So in relation to when I was talking earlier, I was talking about the drug serve pharmacies for the public sector, where that's an initiative we have put in place to reduce the wait time for public patients with chronic illnesses. For the NHF to get more than 1 month's supply on the NHF card program, we do offer that, especially if you're traveling, right? So if you're traveling and you're going to be away for a certain period of time, the NHF will allow you to get more than 1 month supply. We have, so in terms of the private medical providers, how does this policy reconcile private medical providers of more than 1 month supply? Not likely. They would have to get release from the NHF in order to provide more than 1 month supply.
Okay, so the more than 1 month supply is through DrugServe.
Yes, for chronic disease patients.
All right. So
Right.
trust that we're clear on that. All right.
Yeah, and on that matter of the refills, persons should be aware that when you're using the card, you can refill after 28 days. So 28 days, you can go and refill. If you want an early refill, you can get up to 7 days before the end. And then again, you'd have to call the customer care center and request that. And so it can be, do whatever in the back end to allow you to get an early refill. And the same would if you're traveling, you'd have to provide your travel documents, etc., to us, and then we will advise the pharmacist. The pharmacist will see that you're able to get more than 1 month supply to facilitate your travel.
Okay. What's the number to customer care?
906-1106. Very easy to remember.
Yes. 906-1106.
And if you forget, go on the website. All of the information is there.
All right, fantastic. So are there any other frequently asked questions that might not have been asked here?
Can't think of any off the bat.
So it seemed that Serenity did not do such a bad job in covering.
Yes, you did a great job in asking all the right questions in terms of what people want
to ask. Okay, yes. Great. Yeah. Rosin, thanking you for the clarification. Fantastic. Yes. And this is another area too in terms of getting the clarification. So when you go to your pharmacist, you don't go and say, oh, we're supposed to, and why aren't you doing this? So it's great, Rosin, because I'm sure there are others who maybe wanted to ask the question but didn't ask. So they'll be able to share so they can get that response. Go ahead, you will have something to share.
Yes. A question that comes up sometimes is that persons will call to say, there's no money on my card. They've been told there's no money on their NHF card. And there seemed to be, a slight mix-up between the NI Gold card and the NHF card. So the NHF card never expires, and you get help every single month that you're alive and still need that medication. The NHF card never runs out on you, right? And as I said before, it's not money that is on the card per se, right?
It's an access.
Yes. So once you sign up, say for hypertension, then when you swipe your card, the computer system recognizes that you are to get medication for hypertension. Whatever it is that you're to get, it is there for you every single month, which is different from the NI Gold card for pensioners, which has a specific amount of money on it, and that can be used up, right? So there is a difference between the two cards. The NHF card never runs out on you. All right. There are some NHF cards that were issued early in the program, and we used to put an expiration date on it. But the card really does not expire. So even if you have an old NHF card and it has an expiration date on it, the card does not expire. So if anybody tells you that, oh, your NHF card has expired, tell them no, the NHF card does not expire. You can swipe it and it will be good.
Fantastic. All right, Mr. Pusey, Shermaine, do you think it would be possible for the NHF to expand for Jamaican citizens who have met in serious accidents, such as car? Okay.
Mr. Pusey, I don't think so. We have a way to go with, many of the other areas, other conditions to be added. And as I said before, it's the money. It's not endless. And where NHF is there as a support to the funds provided by the government of Jamaica, right? We are there to impact chronic illnesses, to reduce or to help persons to manage their chronic diseases, right? In terms of the health of the country. So it's not likely from where I'm sitting that we will be assisting with issues related to car accidents anytime soon.
Okay. All right, so Blossom needs some clarification. She wants to know if the NI Gold is for pensioners without chronic illnesses.
Well, I don't pretend to be an expert on the NI Gold, but the NI Gold is for government pensioners. Okay. And you can use the benefits on the NI Gold includes medication, but there is an amount of money there for medication. I imagine whatever medication you want to purchase with the NI Gold, is fine. But the NI Gold, like any other private insurance that you have, can be used with the NHF card, right? So if you have NI Gold and you have NHF card and you're buying medication for chronic illnesses, which is what NHF covers, and it's good to have both cards, right? Because the pharmacist subtracts what the NHF pays first, right? And if we pay, say, 50% of the cost of the drug, your NI Gold would be used to pay for the other 50%, and I think it would be 80% of what's left. So your NI Gold card would last longer if you use it along with your NHF card. But you may find that your NI Gold, because of the amount of money you have on the NI Gold for medication, that is going to finish before the year is out. But you can continue to use your NHF card to get your medication. And that's a point to make, whether it's your NI Gold or your Sagicos Medicos, there's another one, private health insurance, you can use it along with your NHF card so that you pay less out of your pocket.
All right, so both Mr. Pusey and Lady Jones understands. So you did a great job in clarifying. All right, yeah. Any closing thoughts as we get closer to the top of the hour?
It was a pleasure being here and having this conversation with you about the NHF card and, of course, about DrugServe as well. I'm happy that we were able to clarify issues for your viewers. And just to reiterate that if you want to learn more about us, if you have any questions at all, please visit our website, nhf.org.jm. Follow us on social media, Facebook, Twitter, and Instagram. And of course, you can always call us or send us an email, info@nhf.org.jm, and chat to us on web chat as well on our website. And remember, our number is 906-1106. Thank you for having me, Winsome.
My pleasure. Thank you so much for sharing space with us here. And let me thank our live viewers and those who are watching the replay as you continue to stay safe out there. There's some more information for you to use to navigate this space. And remember, as always, I ask, do not keep it to yourself. Share it with others around you so they too can benefit from the awesome support from the National Health Fund. So Shermaine Robotham was not giving you Health Watch, but sharing with you on the National Health Fund. On it. Some people will understand that one, but thank you again to you and the team at NHF for responding to the call to share with us here so we have a better understanding and appreciation for how the system actually works. And trust that the doctors who are not yet on board will come on board, so more women will get tested, get checked for their pap smear on a more regular basis. Thank you again. And remember, we connect each Thursday at 8 p.m. We are going over into Fourth Thursday next, and we're going to be having discussions with the Municipal Corporation in Clarendon as we continue to look at the different committees and how they work to serve the people of Clarendon. And those in other parishes, the committees operate similarly across the island. It's just that we are sharing from the Clarendon perspective. But if you want to hear directly from your municipal corporation, reach out to them and ask them to check us out here at Serenity Resource Connector so we can get connected and get you access to the information and the individuals as they share in this space. Thank you again for tuning in, and as always, have a fantastic rest of the night.